Well, Giles Malone here for Space Coast Daily, out in the community, trying to find stories that are exciting and helpful for people. And we're here at BioCellular Therapies in Melbourne, talking with the lovely Teresa Dawson. Teresa, welcome.
Thank you.
Tell us about your story and how Dr. Hermansdorfer helped you.
Well, about 10 years ago, I started getting pain in my right leg up through my hip. And over that decade, it just got more and more severe, to the point where it was difficult to get in and out of my car and even keep my leg on the gas pedal. So I needed to have something, I needed to be taken care of. So I went and had an MRI done and was told that I needed surgery on it. But I did not want to do a hip replacement. I looked around for some alternative treatment and talked to some people where I work, and they gave me contact information for BioCellular Therapies.
Several years ago, when stem cells was sort of the catchphrase, people thought that it would be involving some type of unethical behavior where you're going to be taking babies and aborted babies and using those cells, but that's not it at all. Actually, what we're doing is we're extracting your own stem cells from your own bone marrow, and we're utilizing those cells in your own body to heal itself.
I thought it was going to be dreadful. I thought I was going to be in horrible pain, but I didn't feel anything. I really didn't, and my pain level went down right off the bat, right out of the gate. I had no problem getting up and moving around. I didn't need any medication. I still don't use medication.
Well, I think it's because it's the first time that we're able to offer a therapy where you're actually able to cure something. In most cases, when we treat people with musculoskeletal disorders, it's in a way to try to put a band-aid on it or to try to replace it in its entirety. We use fake joints, other imitation products, or we try to mask the pain by either taking away the nerves that go to those areas or injecting steroids. And what we found was that these are usually temporary ways of treating these types of disorders, whereas with stem cells, you're actually going back in time and you're regenerating the tissue that's diseased. And this is the first time that we've actually been able to incorporate this kind of medicine into our practice.
Surgery is such a dramatic procedure, so you opted for the stem cell. What were some of the reasons why you felt comfortable doing that?
Well, I didn't want to have a prosthetic, which causes a lot of people problems down the road. I didn't want huge scars, and the stem cells, it was explained to me so well that I really believe that this was right for me, absolutely right for me, and it has been. Mm-hmm. My pain level has decreased tremendously.
And where do you see this going, in the next 6 months, 12 months, 18 months? Where do you see the science? How do you see it developing?
Well, there are a lot of people who are starting to take an active interest in this type of therapy now, from the government and down to investigators and even physicians. They're starting to see people come out with great outcomes, and so they're trying to investigate it at a higher rate. I'm not, there's some early funding going on in different universities around the country where they're trying to come up with even more advanced methods of utilizing stem cells. And people who have heart attacks, for example, people who have neurological diseases. So they're actually looking to expand its utilization for a multitude of different diseases.
Well, for you, who's been helping people for years with traditional medicine, on an excitement scale, this must be a game changer for people like you.
Well, it really is, because now it's giving us the opportunity to treat patients to the point where they won't need a knee replacement, they won't need a hip replacement. I believe that down the road, once this becomes more mainstream, that it'll be the standard of care, where, before we offer those types of therapies or even steroid injections.
Well, there you have it. For those of you who are interested in learning more about stem cell therapy, make sure you make a free consultation with Dr. Dowdell or Dr. Hermansdorfer at BioCellular Therapies in Melbourne. Doctor, thank you so much for sharing that with us today, and thank you for all you do for the community.
Great, thank you.